Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today, we will study a very important topic of granulomatous disease. And granulomatous disease will be asked as a short note. It will be asked as a short note in your university exams. So, let's study it very properly. So, what are granulomatous disease? They are basically a disease characterized by granulomas. Okay. In response to a chronic inflammation. So, whenever in your body you are having chronic inflammation, your body will result in the formation of granulomas. What are granulomas? Granulomas are nothing but a collection of activated macrophages. And I have told you that macrophages are mainly responsible for the fight mechanism of your body. These macrophages are basically surrounded by the lymphocytes and sometimes by the multinucleated giant cells for their protection. Now, for the pathogenesis, see this figure. Before coming to this figure, let's just read what we have written. So, when there is persistent antigen or stimulation, if there is a regular infection or persistent infection that a patient is suffering from, then there will be activation of what? There will be activation of macrophages. As a result of which, you know what will happen? There will be activation of T1 helper cells. And the macrophages will get activated. There will be interleukin 12 which will come into the role and they will stimulate the T helper cell 1. Okay, they help in the stimulation of T helper cell 1. Then what will happen? There will be macrophage. The macrophage basically transforms the epithelioid cells, which leads to the formation of mature granulomas. Okay, see this figure, you have the phagocytic cells, then you have the microbes that are there, you have the reactive oxygen species also. There is oxidative burst, pH of the cell is rising, as a result of which what is happening, there is granulomas there are granules which you are able to appreciate, right? What are the types of granules you have? First one that you have is the immune granulomas. They are caused by the persistent T cells mediated, seen in tuberculosis, sarcoidosis and the Crohn's disease. They are seen in tuberculosis, sarcoidosis and the Crohn's disease. This you need to remember. Then you have second the foreign body granulomas. They cause inert and indigestible materials like suture, silica and talc. They are basically caused by the non-digestible or non-soluble materials. Okay. If I talk about the morphology, you have something called as the epithelioid cells. In this, they are activated by the macrophages. They are basically activated by the macrophages. Next, you have is the giant cell. In giant cell, you have the Langerhans giant cells and the foreign body giant cells. Langerhans giant cells are the peripheral ones and they are horseshoe shaped. Okay, like this. Have you seen a horseshoe? They are horseshoe shaped. Okay. Then you have the foreign body giant cells. They are haphazard nuclear arrangement is there, like anywhere the nuclear can be found. Then you have the lymphocytes. They are mainly present in the CD4 T cells. And then you have the fibroblasts and collagens in the chronic granuloma. See this very, very beautiful figure. And if this question on granuloma will come in your exams, you have to draw this diagram. Okay, let's start from the very peripheral. You have the collar of lymphocytes surrounding the epithelioid cells. Here you are able to see the Langerhans giant cells, although they are of this kind of arrangement, right? Then you are able to see epithelioid cells. They are the modified macrophages with abundant cytoplasm and pale staining slipper shaped nuclei. Then you have the caseous necrosis. Here you are able to see caseous necrosis, and I hope you remember that we have read a mnemonic that C for C. Caseous is for cheese-like necrosis, right? I hope you remember. If not, you have to revise the necrosis chapter. The specialist stain and investigation, we use the Ziehl-Neelsen stain, that is the acid-fast stain for the tuberculosis and leprosy. Remember, for the tuberculosis, we use the ZN stain. Then, pass positive for the fungal or organisms. And you know what? You have a disease called as the 𝗵𝗵𝗵𝗵 disease, right? In the 𝗵𝗵𝗵𝗵 disease also you use this stain because it is composed of glucose. You use polarized light for the foreign bodies, serology, culture and PCR for specific organisms. Then you see the ACE levels that are elevated in your sarcoidosis. The ACE levels will be elevated in your sarcoidosis. What are the clinical features you will be able to see if the patient is having TB? Tell me, what are the clinical features you will be able to appreciate? There will be weight loss. There will be fever. Very classical, there will be cough. There will be fatigue. Right? If I say if the person is having sarcoidosis, very characteristic will be there will be a bilateral hilar lymphadenopathy. This is very classical of sarcoidosis. If I'm telling you to write the clinical features of leprosy, what you will tell me? You will tell me, ma'am, we are able to see a very characteristic thing called as the hypopigmented patches. And tell me guys, lion-like faces is seen in which type of leprosy? And you also have to tell me the treatment of both the types of leprosy. You have to read it from your pharmacology lectures and tell me, okay? Now, in the Crohn's disease, you will be having abdominal pain, diarrhea and weight loss. And you will also be able to see the skip lesions, right? You have the Crohn's disease and ulcerative colitis. Now, let's solve this question. What is the hallmark histological features of granulomatous inflammation? Is it fibroid necrosis? No. Is it epithelioid cell cluster surrounded by the lymphocytes? No. Is it the caseous necrosis only? No. Caseous necrosis is a part, but only is not. So the right answer to this is the dense neutrophilic infiltrates. Next, which of the following condition is not typically associated with granulomatous inflammation? Is it the tuberculosis? No. Is it the syphilis? We have not read about syphilis. It's not syphilis. Is it the acute pyogenic meningitis? We have not read about that also. The answer to this is your sarcoidosis. Okay. So guys, this will be asked as a short note in your exams. So read this topic from that perspective only. I hope I made this lecture very clear. If you are having any sort of doubt, please feel free to reach me. Feel free to DM. Thank you so much.